Today, we're looking at the insulin pen, how to prepare it, prime it, push it, and pause it. And we're going to take care of all of that right after this. Welcome back. My name is Tammy and this is Nurse Minder, and on this channel we do everything nursing. So if you're new here, consider subscribing below so that you get the next video when it's released. We first need to prepare the pen. This includes making sure we have the correct insulin type, which is often confirmed with the patient's MAR and a label on the pen, checking the expiry date, and the appearance of the insulin itself. So after we verified the correct type of insulin, we want to make sure that if it's cloudy, we invert this 10 to 20 times to get a consistent mixture. Once we can ensure we have even mixing of the insulin, we are now ready to swab the rubber seal with an alcohol swab. After 10 seconds, you can then put on your auto shield. Simply remove the paper, the outer covering there, push and twist the pen needle onto the pen in a clockwise direction until it meets resistance. You don't need to over tighten it. Now on to step 2, priming the pen. Before every injection, we need to check that there is insulin flowing. We do this by dialing up 2 units at the end of the pen. Angle the pen upwards. You may need to tap gently to remove air bubbles. Push the injection button at the end of the pen and watch for a stream of insulin. If you do not see any insulin at this point, repeat the priming process. You are now ready to select your insulin dose by dialing up the insulin required. Step 3 is to push the injection. Of course, we need to prepare our patient's skin, selecting a site that is suitable and using an alcohol swab to cleanse it. We're going to insert at a 90-degree angle, and what I want you to notice here is that as it's pressed against the skin, the clear auto shield retracts such that the white shield is against the skin and flesh. Maintaining constant pressure against the skin, you can now deliver your dose by depressing on the button. Pause and hold for 10 seconds after dose delivered. Now, as a point for teaching, you can see there's insulin left on the external side of my injectipad. Not ideal. I'm not sure how much actually went into my patient. So if you find this happening to you, you may want to check that you're doing the pinch correctly and that you're releasing the pinch before you remove the needle from the skin. All that's left to do now is to remove our sharps, discard, clean the pen, put it away, and make sure you document. So you are now primed and ready to proceed to administer your insulin by policy. Can I get any more P words into this process? I think I just did. Make sure you subscribe below so that you stay tuned, and the next video when it comes out, you will be the first to know. And until then, make it a great day.